Welcome to this month's Tolly Joy Partners in Parenting session. I'm Patricia and I'll be your host for today. To mark World Breastfeeding Week 2021, our session today will touch on a very important topic, breastfeeding. It's certainly our pleasure to have with us Ms. Lim Lay Lee, who is the Nurse Manager and Lactation Educator at Subang Jaya Medical Center. She has kindly consented to share with us breastfeeding tips, and I'm sure our new mothers out there will appreciate this session very much. So without further ado, over to you, Laylee, for your sharing.
First of all, let me introduce myself. My name is Ms. Lim Lay Lee. I'm a nurse manager as well as lactation educator in Subang Jaya Medical Center. Today, I'm going to share with you on the breastfeeding tips. So before we start with the breastfeeding tips, I just want to let you know, breastfeeding a newborn baby doesn't always come naturally. It looks very natural, but actually it takes a lot of practice and patience. It can be very loving and happy bonding experience, but it can be filled with tears and anxiety if whatever that you have planned is not goes very well, especially when you meet with a lot of challenges in breastfeeding your baby. But don't worry, once you establish with your breastfeeding, it becomes very easy and natural. And for most mother, babies have a very enjoyable experience. And it's a very worthwhile experience when you breastfeed your baby, able to breastfeed your baby. Let me tell you what is exclusive breastfeeding. Exclusive breastfeeding means that the infant receives only breast milk, okay? No other liquids or solids are given to the baby, not even water, with the exception of oral rehydration solution or drops, syrups, or vitamins, minerals, or medicine. And you should breastfeed your baby exclusively up to 6 months of age, then start to give weaning diet. If you can, continue be up to 2 years old. Benefit of breastfeeding. I believe we know that there's a lot of benefit by breastfeeding our baby. So let's start from the head to toe, okay? So from the baby, we have a better mental development. And of course, it will reduce a lot of risk of infection. So it will lower risk infection of the ears, respiratory infection, and baby will have lower risk of diabetes, lower risk of childhood obesity, and it also protects against diarrhea, allergies. If parents have allergies, the more you breastfeed your baby, you will reduce the risk of allergies. And to mothers, there's benefit to the mother, which it promote postpartum weight loss, that you can get back to your weight faster, slimmer. So lower risk of breast and ovarian cancer. It also delay your ovulation. So let me share with you the anatomy and physiology of breast. As you breastfeed, you need to know what is happening with your breast, okay? So from this picture, you can see our breast from outside. You can see your breast consists of nipples, and the above the nipples you can see the areola, and on the areola you found there is a lot of areola glands. Okay, these glands secretes some secretion enzyme to protect your nipples. Okay, so you doesn't really need to clean your breast, your nipples area before you feed the baby. So let's go inside the breast and see. So inside your breast, it contains a lot of, the breast gland, okay? Inside the gland, you will have a lot of tiny cell called alveoli. This alveoli is the cell that will produce milk under influence of hormones. So when the milk is produced in this alveoli, it will slowly flowing down to the ducts. This duct we call lactiferous sinuses. It is located just behind your areola. So the size of your breast is not determine how much milk you're going to produce, okay? Because most mother, the breast, the gland in the breast is, everybody will have similar sizes of gland, which are about 18 to 20 lobe. So it's important for you to know the location of the lactiferous sinuses. This will play a part when you want to latch your baby onto the breast. Let's see the different process of breast, okay? When you have non-pregnant breast, your breast, the size is the normal size that you have. When you are pregnant, the size of your breast will grow slightly bigger. But when you start to lactate, your breast size will increase. So sometimes you have to get the bigger size bra. Okay, you cannot wear the bra that you wear when you were pregnant, at least 2 sizes bigger. This is to accommodate the size of breast that you're going to have. Physiology of milk production. I did touch a bit on the alveoli just now. Is under influence of the hormones. So our body will produce 2 hormones, which is very important. Okay, milk production is under the influence of these 2 hormones. The first hormone is prolactin. Prolactin is responsible for milk production. It influences on the alveoli. The volume is more at night, and it's also responsible to suppress ovulation. So you won't have period, yeah? And the other hormones called oxytocin. These hormones make the milk flow down to the ducts. It enables the baby to get the milk from the breast because it let the milk drip down. And the milk drip down, the terms we use here is let down reflex. At the same time, this hormone also can cause sudden thirst. So you will be wondering, why are you very thirsty each time that you are breastfeeding? This is due to the hormones that has been secreted out to the body. So it's a good news. You know the hormones coming out when the baby is stimulating on your breast. At the same time, this hormone can cause uterine contraction. And you will have some crampy feeling when you breastfeed your baby. So this is absolutely normal, okay? And it's also called a happy hormone, also love hormones. It makes you feel sleepy and relaxed. All these hormones, it only take effects when your baby is latching onto the breast. Okay? When the baby latch onto the breast, on the nipple, there's a lot of nerve fiber. This nerve fiber will send the signal to the brain, okay, to ask the brain to produce this hormone. So the more your baby suck on the breast, the more hormones will be secreted out to the body. So we already know the physiology of the milk production. So how to make sure that the milk will come in faster, right? So the next tip is early start, which is skin to skin. Ideally to start right after birth and should last at least 1 hour. So because during this time, baby is alert and suckling instinct is strongest in the first hour of birth. Later on, the baby tends to be more sleepier. So it is the best time to breastfeed your baby. How it is done? So baby is placed next to your bare chest. Most baby will breastfeed while skin to skin in the delivery room. Benefit from skin to skin, it helps to steady your baby heartbeat and breathing. At the same time, it helps to keep your baby warm. You are transferring your heat to your baby. Bear in mind, when the baby comes, when the baby was born, outside environment is cold. Okay, so the moment you put the baby onto your skin, you are transferring the heat. So baby feel very calm. And it improves bondings. So you can get breastfeeding off to a good start. If you want your husband to do skin to skin, you can also include him in, unless he is not very comfortable in holding newborn baby. Yeah. So the other tips is make sure the latch is correct. A good latch is important. It ensures you make enough milk. It ensures baby also get enough breast. It also prevents sore nipples. So good correct latch, whereby the baby mouth should be cover the whole areola as much as possible. And the baby lips must be flanked out, okay, and the chin must touches the breast. Okay, you see the picture. The first picture to show how you position yourself and your baby. Yeah. So first of all, mother have to sit upright to ensure your back, arms, and leg are well supported. So you have to bring your baby at the breast level. Position the baby at the breast level. Baby position tummy to tummy, means the baby tummy is against your tummy. and the nose facing the nipple. Use one hand to support your breast and the other to support the baby's head. Tilt the baby head slightly, because when you face the nipples to the nose, the baby starts smelling the breast. And when the baby starts smelling the breast, baby will have this rooting reflex. They will be searching. So they will look up. If the baby not looking up, you help the baby tilt the head slightly upwards, okay? So you tickle the baby's upper lip with your nipples. This will help the babies to open the mouth wide. And then you bring the baby to the breast. Remember, we always make the mistake. We bring ourselves to baby. Most mother, they lean forward. Lean forward is not right, okay? You make sure you bring the baby to the breast, not the breast to the baby. So the moment the baby opens the mouth wide, you should bring your baby to the breast. So the baby will grab big area of your areola. And then when you notice the baby grab correctly, the baby will be sucking, okay? When the baby suck, you shouldn't feel pain. And you shouldn't hear any sound, and you don't see any dimpling. Okay, and the baby lips, what you need to look out for, the baby lips should be flared out and chin should be pressed against your breast. Bear in mind, if you notice the latch is not good and you are feeling pain, all right, and the baby making a lot of noise, please break the seal by inserting your little finger, your pinky finger, into the corners of baby mouth to release baby mouth from the breast. As the baby is sucking onto the breast, the baby is creating a seal. So you have to break this seal. So the next picture will show you what is the good attachment. I already mentioned a little bit on the earlier slide. Good attachment, baby mouth is wide open. By my baby mouth wide open only for a few seconds. So you have to be very quick to put your baby onto the breast. Yeah, if you wait a little longer, the mouth might close and you get a smaller mouth. So when you want to put onto the breast, the baby will be getting your nipples. So this is not good. The latch is wrong. So the other tips that you have to see, the lower lid is turned out, chin is touching the breast. And the baby's cheek, you will notice, is full and rounded. At the same time, you can hear the baby swallowing sound and it's pain-free. Poor attachment, yeah? Poor attachment, the baby mouth not wide open, lips is curled in, cheeks is dimpled during suckling, and baby make a lot of clicking noise. Although you thought it's very cute, but you shouldn't continue, yeah? And the other thing you feel is painful. Okay, pain during nursing because the baby is sucking onto the nipple. Doesn't mean the baby no teeth is not going to injure your breast. Yeah, the baby will injure the breast if the latch is not correct. Okay, let's talk about rooming in. Rooming in is when your babies and you stay in the same room in the hospital or even at home. If the baby is with you, you will increase the chances to bond with your baby and to learn to care for your baby. Okay, so this will make you practice more on breastfeeding. It also will let you recognize your baby is hungry. You can notice there is some feeding cue, yeah? So you can feed the baby on demand instead of strict schedule. When you feed on demand, you will have less complication such as engorgement. Rooming in is not easy. By bonding with your baby, you will understand your baby more. So you will be feeding whenever the baby feel hungry. Feeding cue, the baby will show you a feeding cue that is a few stages. So it is nice for you to recognize it at the early stage. Feeding cue means your baby shows they are hungry. And so you have to feed your baby when they're hungry. So feeding cue, like I said earlier, it prevents breastfeeding complication. So the more you feed, the more you empty your breast. So you won't have any chance the breast to be engorged. And it helps your milk to come in quickly. Feeding cues keeps the baby happy. Early cues, there's 3 stages: early, mid, and late. The early cues, the baby will show you the sign that she is stirring and opening the mouth and turning the head, seeking, okay, like searching. We call this rooting reflex. Okay, this is telling you already hungry, started to be hungry. So you have to pick them up and feed them, okay? Mid-cue meaning, mommy, I'm really hungry. So what would they do? They will be stretching and they have a physical movement, and then they're moving their hand to their mouth and trying to suck their fingers. The late cues, mommy, feed me, I am really upset. They start to cry. They get very agitated and they can cry until their face turn red. So this is a late cue. You have to begin feeding your baby at the early cues. If you cannot catch the early cues, it will be at mid cues, okay? Don't feed the baby at late cues. The baby become very agitated, then it's difficult for you to put the baby onto the breast. And you will be stressed up as well when the baby is crying. So another tips is position. You may have several preferred position, okay? Depend on the baby size or mother medical condition and feeding location, because you can be feeding on the bed or feeding in a chair. You may use also several positions to hold your infant while breastfeeding. So each baby may prefer a particular position, and also the sizes and the preference of the nipples, okay? So it's nice to rotate, to try a few positions. So the best position is the one that is comfortable for the woman, for you, and allows the infant to latch on, suckle, and swallow easily. So you may not know which one is the right one, but it's nice for you to try all the position. You might find the right one and the comfortable one. So make sure when you position yourself, especially when you're sitting on the chair, your back is well supported. Okay, either you roll or you sit on a supportive chair, and make sure you have a lot of support. Okay, like nursing pillow. It serves a very good help in nursing your baby. You can use it to support the baby, so you not straining your shoulder and your arms when you're holding your baby. And also a lot of supports on your elbow. Prevent back strain by having a footstool if your chair is a bit high. So let's talk about what is important. It helps to give a good latch. It prevents you to have sore nipples, and help you to make enough milk and help baby to get enough milk as well if you're comfortable. So tips to get started is get yourself comfortable. Use pillow to bring baby up to your chest level. Okay, baby's ear, hip, and shoulder should be in a straight line. Remember that, you don't turn your baby face, but the baby must turn together with the body, not only the head. Bring baby to your breast. Don't bend forward. I will be repeating this because we tend to make mistake sometimes, but try to, it's okay to make mistake. Don't worry, but try to remind yourself what is the right way to do it. So there's a few breastfeeding position here. Okay, the first position is a natural position that we always hold our baby, called cradle hold, whereby your forearms support the baby's back and your hand supports the baby bottom. Hand opposite the breast that the baby is nursing is supporting the breast. And make sure don't lift up your shoulder. Now, when we hold the baby, we tend to lift up our shoulder. Try to put your shoulder down. You should be in a relaxed, comfortable position when you do this. Another position is a cross cradle position. Cross cradle position is work well for small babies or when baby is having a hard time to latch. How to do it? You hold baby across your lap using the arm opposite to the breast the baby is nursing onto, and then support the baby. Use the other hand, okay, on the same side of your breast to support your breast and bring the baby to the breast. In this position, you have a better control on the baby's head. You can bring the baby to your breast easier by doing this, okay? Especially first-time mother, you're having difficulty in how to hold your baby. If you try this position, you find it's easier. After this position, after you put the baby on cross cradle hold, ensure the baby really latch on. Then you can switch your hand back to make into a cradle hold. The other favorite position is side lying position. You lie on your side, Okay, just like when you are pregnant, that you are sleeping on the bed, you are lying on your side, I'm sure that you will put the pillow in between your feet. Okay, it's the same position. The only difference is you just have to stretch your arms up under your neck. Okay, so the baby is lying by your side, facing you. This is a very comfortable position for mother who have hemorrhoid, painful episiotomy, or mother who is sitting too long and having backache. Okay, make sure your back and is supported. The other position is football hold. Tuck your baby under the arm of the side you are nursing on. So baby feet should face your back. Support baby's head as you bring closer to your chest. It works very well for cesarean section and if you have a large breast. In this manner, you'll be able to see your baby. For C-section, because it works very well, the baby is not on your belly. So the baby will not directly pressing on your belly. So you find it is more comfortable in this position. So let's come to the very hot question, yeah? How do I know my baby is getting enough breast milk? So what you need to know is you have to feed your baby 8 to 12 times in 24 hours with a good latch. Yeah? When you have a good latch, the milk will be transferred to your baby from your breast. And the other thing, you can hear baby swallowing during feeds. The other thing as well, the other thing that you can see as well, which is the baby is passing 1 to 2 loose stools or meconium, at least 1 to 2 wet diapers per day in the hospital. This will be at the beginning, first day and second day of life, because at this point, your colostrum is not that much. Okay, and by days later, the milk production started to come in. So you notice your baby will have more wet diapers and stools. Your baby also seems to be calm, satisfied, and contented between feeds. This will tell you your baby is having enough breast milk. Your baby's stomach actually is very small when they are born. On day 1, it's about the cherry size. It can take up to 5 to 7 meals. Come to day 2, they grow slightly bigger. It become a walnut size. Take up to 20 meals or more. Come to day 3, look at the size, it go bigger. It can take up to 45 to 60 meals. It become like a apricot size. The amount of colostrum your first milk you make is the perfect amount for your baby's stomach. At this stage, your baby will be wanted to be on the breast very frequent. So it is nice for you to continue to feed your baby as and when the baby want to drink. So this will make the baby have enough feed. So let's see the stages of your breast milk. The first 3 days, you will produce colostrum. You look at the color, it's very thick and yellowish. Comes about day 3 to after day 3, it can vary, okay? It can vary. It can start from day 5, your transitional milk. This is the time that you notice there is changes in your breast. Your breast start to increase in size. It feel warmer. It feel heavier. And it is tender. So at this stage, your transitional milk start kicking in. Transitional milk is the color is a bit lighter, but it's still yellowish. It's a mixture of the colostrum and matured milk. It lasts roughly about 2 weeks. After that, your matured milk will start kicking in. Your matured milk contains 2 types. Okay, it's the frontal area called fore milk, and the behind area it calls hind milk. So colostrum, it is yellowish, creamy and thick, as I mentioned before, and it is high in proteins, vitamins, mineral, and antibody, and it contains less fat, small amount. So your baby will get hungry quickly and it digests easily. And come, like I said, from the 3rd day or can be from the 5th day onwards until up to 2 weeks is a transitional milk. It's a mixture of a colostrum and matured milk. It's still yellowish, like I said earlier, but it's lighter, yeah. But it composes higher in fats. lactose, and vitamins. Matured milk, usually after 2 weeks, you will notice the matured milk, it is more diluted, less concentrated as it contains more water. And the fore milk, like I said, the front part, right? The color will be a bit whitish. It has less fat, but high in lactose, water, sugar, proteins, mineral, vitamins. High milk is the creamy part, the highest in fat and calories, but less in sugar. So that's why when you breastfeed your baby, you must ensure you finish one breast first before offering on to the other side. Because the baby have to take the fore milks and the high milk for them to feel full. And don't give bottles and pacifier. If you give bottles and pacifier, your baby will not be interested on your breast because they haven't get used to breastfeeding yet. Once you introduce it, especially the bottles, you will make the baby confused. And then eventually they don't want to be on your breast anymore. The other thing is the pacifier. Pacifier can suppress hunger. So it may take away the time for you to breastfeed your baby. But you can use bottles and pacifier only after your baby already established in breastfeeding, especially when you wanted to go to work. So then only you should introduce bottles and pacifier. While you are still in the crucial period, you haven't established your breastfeeding yet, I recommend you all do not use bottles and pacifier yet. So for you to have a good milk supply, you need to be healthy. When you're healthy, your baby will be happy. So make sure you keep yourself hydrated. Drink at least 8 glasses of water a day. Eat well-balanced diet. And continue with your prenatal vitamins. Okay, you need to know your nipples. Nipples come in a different type, okay? It can be flat, inverted, big. Sometimes it can be very small. So you will have different challenges if you have inverted or flat nipples. But don't worry, there is something in the market that you can use to help for your nipples to protrude. Okay, you can get a nipple former. Besides that, you can get a nipple shoe. If you have a flat nipples, you find it difficult to latch the baby onto the breast. If you don't have problems latching on the breast, you doesn't require it or this gadget. And the other thing is you have nipple puller. You also can use breast pump to pull out the nipples. Okay, this is only applicable for those mother who are not able to latch the baby on the breast. This part is breastfeeding complication. Breastfeeding complications will come in if the latching is not right. Okay, you will have sore and cracked nipples, usually due to poor latch. And when you have this condition, sometimes it makes you very difficult to latch onto the baby because it can be quite painful to certain mother. But once you latch correctly, even with a sore or cracked nipples, the pain is bearable. So if you have this, what you need to do, you have to apply a thin layer of your breast milk, okay? And on top of that, you put the nipple creams. It keeps your nipples soothe and heal your cracked nipples. And allow it to air dry. It will heal up after a few days. If you have difficulty in latching, I would suggest you to do hand express. The other complication I want to share with you is engorgement. Engorgement happens when the baby does not adequately remove the milk from your breast. Yeah, so your breast will feel hard, painful, hot, and appear shiny. It can cause difficulty in latching, as when your breast is full, your nipples tend to flatten. But if you have breast engorgement, what you can do, you apply warm compress, and after warm compress, you massage your breast. Ensure you put the baby onto the breast. If the baby cannot latch, your nipple is a bit, your areola is a bit firm. What you can do, you use your hand to express your breast milk. We call this hand express. Make sure your areola region is softened. So once your areola region is softened, your baby will be able to latch onto the breast. Remember, at this stage, the baby can be cranky because they cannot latch onto the breast. You just have to be patient with your baby. This is this is called mastitis. It's an infection onto your breast. Yeah. due to what is that? Sometimes cracked nipple, sore nipples. Okay, the bacteria or the germs can travel from your nipples and go into your milk gland, caused by improperly or untreated plugged out or cracked nipple. So what is the symptom? You need to recognize this symptom because it's very important. Once you have a mastitis, your milk production or milk supply will reduce and you will have fever, and it is very painful experience. Yeah, the symptoms can be mild at the beginning, and it will be like fatigue, you have flu-like muscle aches, fever, or headache. It becomes worse when you have intense and localized pain, red and swollen breast. So keep an eye on your breast. If you see all these signs, redness onto the breast, localized pain, the milk is not coming out, you need to see a doctor. So when you come to the hospital, you need to remember to bring few things to help you with the breastfeeding. First of all, you have to bring your nipple creams, your nursing bra, breast pump if it is needed, and nursing pillow.
Thank you very much, Lay Lee, for your insights and sharing. I'm sure our mothers watching have benefited from your presentation. Now, perhaps we can chat a little bit about some questions that we have on hand. Now, to kickstart our question and answer, let me just ask you this, Lay Lee. We do hear of moms who have low milk supply. So what actually causes this, and how do moms increase their milk production?
Okay, to answer the first question, low milk supply, usually if the mother have low milk supply, mother is not emptying her breast completely. And the other thing is because you see, when you baby empty the breast, the hormone the signal will be sent to the brain for the hormones to produce more milk. So if the breast milk is not empty sufficiently, the supply will drop. The other thing, it could be mother did not latch the baby properly. Remember, when you latch baby correctly, the baby will have a very good effective sucking, and the baby will be able to empty the breast. The other thing is mother who is very stressed. Right? If you are stressed out, yes. So that will affect your milk supply. So to boost up your milk supply, feed your baby on demand or on cue. Okay? So when you feed your baby on demand, the baby will keep on sending the signal to the brain. So more demand equal to more supply. Yes, so you also have to drink plenty of fluids, have enough rest, and get your husband to participate to help you. So if you have enough rest, your husband is helping you, you found that it's very, very relaxing, and you will be quite happy, you see. Your husband is there to be with you and help you with the breastfeeding journey.
So it's really a 360 approach and everybody has to participate, right?
Yes, yes. If you have family member, it would be good as well, especially your mother-in-law. All right. Yes. Because it's not easy. It's not easy.
Yeah, I think you started your presentation by saying breastfeeding is not easy.
Yes, but it takes a lot of perseverance and motivation.
But I'm sure there's always benefits for babies to be fully breastfed, right?
There is a lot of benefit. You cannot imagine.
Yes, I experienced that because I'm a fully breastfed baby in that sense.
Oh, really? Look at you now.
I enjoy a very close relationship with my mother as a result. We have a very strong bond because of that breastfeeding. Yeah. So I always tell people, hey, breastfeed your kids, you get benefits at the end of the day, right?
Yes,
okay,
yes.
That's the other question. When should moms actually start pumping their milk?
Okay, this question can be a bit tricky, huh? Some mother who is not able to breastfeed, okay, they should pump early. As soon after the baby is born, 6 hours later. So they should start pumping their breast milk, the one to direct latch, okay? But for those who direct latch, they can pump about 2 weeks before they go to work. Feed one side, pump on the other side. Or if they don't want to, in other circumstances, they can pump if the baby did not empty their breast. After each session, or the baby cannot empty, they still feel their breast is firm and hard, and the baby is already fallen asleep, they can pump their breast. Okay.
So there are
Some baby, there is some baby just a small eater. All right, and supply is more than the demand. So it's better for the mother to pump to prevent the engorgement, because once the breast get engorged, the inhibitor in the breast milk will send signal to the brain not to produce milk. So eventually, after engorgement, the product will drop.
Yeah, my next question was also going to be on engorgement. Maybe you can share a little bit more of how we can avoid that condition.
So I already answered some of it. From the pumping, this one. Try to room in with your baby, not to let the confinement lady look after your baby. You see, for Chinese culture, we ask the confinement lady to look after our baby, so we can have a good rest at night. Okay, but that will cause the mother to have engorgement. You should sleep with your baby, co-sleep with your baby. So you will understand your baby, you feed on cue, demand feeding. By feeding on demand, the breast will not have the chances to be engorged. So the baby keep on draining the milk very well. The other thing is ensure the latching is right.
Okay.
Okay.
So all these are very important tips for our moms out there.
Yeah. Okay, if you notice the breast is still not empty, then come back to the question 2 lah. Pump the breast. Okay. Yes.
All right. Okay. I think one hot topic that's really circulating right now is the COVID pandemic, right? And we do know now many people are quarantining at home if they have COVID. So if a mom has delivered and there could be a condition where the mom has COVID, for example, or their family members quarantining in the same house where baby is staying. So how do parents and moms manage this situation?
If mom is suspected or can be COVID positive mother, they still can stay together with the baby. If possible, they room in together with the baby if other family member is positive. So what the mother need to take precaution is she have to wear mask when she handle the baby, because the COVID-19 transmission is by droplets. So they have to wear masks and ensure they hand wash their hand frequently, at least with alcohol-based hand rub for 20 minutes, or they use soap and water to wash their hand for about 30 to 60 seconds. They have to adhere to this. They still can continue breastfeed, because breastfeeding is outweigh the infections. And inside the breast milk, there is a lot of antibody that will protect the baby.
Okay. So even if members have COVID, it's still okay. Just keep the members away from the baby, I would
yes.
And you can still continue.
The baby only stay with the mother. Or if the mother choose not to direct latch, she can ask somebody who is not COVID positive patient, or not COVID positive, let's say the husband or the father of the child is not COVID positive. The father can help to feed the baby, but using express breast milk, if the mother don't want to be together with the baby. But the father still have to wear mask, take the necessary precaution, okay, wash all the breast pump equipments frequently, yes, with soap and water, and always make sure to wash hand and wear mask at all times.
Yeah, okay. Any other final advice that you have based on your breastfeeding tips and these questions? But I think you've been quite comprehensive in your sharing. Any advice you want to offer to parents in closing the session?
So the sizes of breasts may be different, okay, but it doesn't determine your milk supply. So please feed your baby on demand. The more you feed, the more supply you will get. Okay, have an open mind, relax when you're breastfeeding, get your family members to help you. Okay, get the right person to guide you. Don't listen to somebody who haven't breastfeed before. Okay, they might make you feel very confused, especially during confinement when your hormone is really not balanced, you feel very stressed out.
Thank you so much for your words of wisdom and experience, Lady. It's been a pleasure having you with us. And we do look forward to future opportunities where we can tap on your insights and your experience. Thank you very much.
You're welcome. You're welcome back.
Everyone out there, thank you too for tuning in. Feel free to share this video with your friends who are new moms, especially. So happy breastfeeding, everyone. Till our next edition of Partners in Parenting, take care and stay safe.